Dr. Rao, let's go to one of the questions that we had that said that how long after a baby is born can you determine whether the baby has sickle cell disease or not?
Okay, so in those countries, developed countries, I would say, there is a mandatory newborn screening program that is mandatory, meaning every child who's born is supposed to go through that screening. So that screening detects sickle cell disease and other important hereditary disorders. Okay. But in our part of the world, and not only here in resource-limited settings, it's diagnosed only opportunistically, meaning any child who comes to the hospital with symptoms suggestive of sickle cell disease or other infections that brings the child to the hospital. So electrophoresis is done to diagnose sickle cell disease. However, sickle cell disease can be diagnosed even at the newborn period by a special test called it's done by doing something at the heel. We call it as blood test. Though not available nationwide, in Ghana, we do have pockets of newborn screening going on as pilot projects. And we do have a newborn screening program currently running at the maternity or department at the Kolebu Teaching Hospital. So in the newborn period, it is possible to diagnose, but just that we cannot use the routinely available electrophoresis test to diagnose sickle cell disease in the newborn period.
Okay, so I happen to know that this parent is in Ghana and she has a newborn. Well, I'm not sure if the baby is still within the newborn period, but you said that we have a newborn screening currently going on in Kolebu, as happens in developed countries. At birth, yeah, it can be determined whether your baby has sickle cell disease and some other inherited diseases. But this parent who did not deliver in Kolebu and who has a baby and wants to know whether the baby has sickle cell disease now, can the parent walk in with the baby and ask for that test, the heel prick, to be done for the baby?
Okay. So because it is a pilot project currently we are running in the teaching hospital, it's just restricted to those babies who are born in the maternity block of Kolebu Teaching Hospital, and also for those babies who come to get the vaccination schedule, who attend the vaccination clinic up to the age of 6 weeks. So beyond 6 weeks, we would rather wait for summer weeks to get the electrophoresis done, because from 4 months to 6 months, we can actually do the widely available hemoglobin electrophoresis to diagnose sickle cell disease. And I want to emphasize one more thing here. The routinely used Sickling test or the solubility test, they are absolutely not indicated, because that can really mislead people from knowing whether they are carriers or they do have sickle cell disease. So we strongly discourage any health worker or any community person from getting the Sickling test to diagnose sickle cell disease, because the results could be misleading.
Okay, so what you are saying is that we should not use the Sickling test, the test that we call Sickling, to diagnose sickle cell disease. That's what you are saying.